couple of words about some opportunities for the ecosystems coming up from the projects that we as the Global Health Connector are engaged into. Just like one word of introduction, we as the Global Health Connector currently participate in some 15 multi-stakeholder international projects. There are research and innovation projects. There are some projects financed by the Erasmus Plus project, which are for skilling, upskilling, cross-skilling healthcare professionals, some policy-related projects. And I have now two opportunities that you can share with your ecosystems. If you would like to hear more, you can reach out to me or to Dimitris. We always share it also on our LinkedIn, on our social media, and we are happy to provide you also some small snippets to your maybe newsletters or mailings to your ecosystem. So first is a hackathon. This hackathon is very accessible because it can be attended from any place in the world. It will be organized in Athens, but also teams can join online, and it's in December. So the registration is open, and yeah, now is the time to promote this, to engage the teams, the ecosystems to participate. What is it all about? What is Gravitate Health? I think some of you, I think Gisela, at least, our colleague from Singapore and from Spain, who is a little bit engaged in the cost-benefit analysis for Gravitate Health and understanding the market for G-Lens solution, knows a little bit about that. But just very shortly, the mission of the Gravitate Health is to provide patients with information they need about their medication, but not just the information about their medication, but the information that is adapted to their context and preferences of the patient, of the end user. And long story short, this adaptation, this personalization of the healthcare information would be delivered through the so-called lenses. And some lenses are already developed, some, like, for example, pregnancy lenses developed, but more lenses should be developed. So of course, this is very technical. This is for the IT developers, for people who know about the integration, about the interoperability of the data. But this is also a real opportunity to participate in the development of this solution, and there are also some prizes. So the first team that wins will receive the prize of 5,000 euro, and of course those solutions will be then further developed together with the team. So this is something that we would like to raise to your attention, and I will also put the link to the chat after I share this. And the second one is the open call for early adopters of the X-Share yellow button. And here, this is another project called X-Share. And in short, the X-Share develops a so-called yellow button, a functionality that would be placed in the applications, in the health portals. And thanks to this functionality, patients would be able to download their healthcare data and share it with the healthcare professionals, with the other apps in the long name European Electronic Health Record Exchange format. European Electronic Health Record Exchange format is a format that will help us all to share the data in a way that actually we will be able to share it cross-border and with the different providers. So this is the, and I hope that now, Dimitris, you can put a link to this X-Share open call. So this will be open until mid-December. Some of you from the ecosystem, you already received the email from us, I think in August, when we were opening this call, and you I think you shared it already with your ecosystems, but this is for the early adopters. So this is develop this functionality further and test it. So this is from me. Also, maybe one word also, because we have also under the Xshare project, so-called community of excellence. So the multi-stakeholder community for everyone interested in learning more about the European Electronic Health Record Exchange format. This community is growing. We have now 190 people sign in, so people represent themselves. There is no, they come from different sectors, but they don't represent their organization. So it's very accessible, very diverse, and we have the meeting of the community of excellence on the 27th of November. That will be an online meeting. And then there will be also face-to-face gathering during the Radical Health Festival in January in Helsinki. So that's about the Xshare. And yes, if you want to also know more about us as the Global Health Connector, our projects, then feel free to reach out to me. And when Adriana will share this presentation with you, there's also a link to our capability statement presenting what we do, and maybe also a little bit background material for our January meeting. So that's from me. Thank you so much.